Welcome back and welcome to your second trimester of pregnancy. During this trimester, you may find that some symptoms have improved from the first trimester, and you also may experience some new ones. Remember, every pregnancy is unique. Many women say that the second trimester is the most comfortable and energetic of the three. During this trimester, you will look forward to certain milestones such as the baby kicking, finding out the gender, and seeing the growth of your pregnant belly. During this module, we will address the following topics and questions: your changing body and what to expect, the change of symptoms you may experience, how do your nutritional and fluid needs change during this trimester, how much weight should you expect to gain, 3 nutrients of focus, labs and testing during this trimester, and the excitement of quickening. Your changing body and what to expect. During this trimester, your belly will continue to grow. Soon, the bloat will turn into the pregnant belly that you've been looking forward to. By the start of this trimester, your uterus has grown large enough to rise out of the pelvic cavity, and by the end of this trimester, week 22, your uterus will have grown to the height of your belly button or just below it. As your belly is growing, your skin is growing too. This expanding skin may cause some itching and irritation, which may continue through the remainder of your pregnancy. Itching can make the irritation worse, so if you're experiencing this irritation, speak to your obstetrician or healthcare provider on which anti-itch cream or lotion they recommend. You may start to experience aches on the side of your lower belly. This is referred to as round ligament pain. Round ligaments are in the pelvis and are similar to a pair of cords. They stretch to support the uterus as your pregnancy progresses, and these cords help connect the front of the uterus to the groin area. The pain you're feeling in this area is related to tightening or spasm of these ligaments and may also be causing the irritation of nearby nerve fibers. You may find that this pain is triggered by repetitive movement, vigorous activity, rolling over in bed, or after waking up. Some strategies to help alleviate this pain include wearing a belly band, lower intensity exercise routines if approved by your doctor, as well as rest and relaxation. If you're concerned about the amount of pain you're experiencing, be sure to speak with your obstetrician. Another symptom you may experience from your stretching skin is stretch marks, which almost 90% of women experience. Stretch marks are common during the second and third trimesters. These stretch marks are either pink or red colored marks or lines that occur on areas that rapidly stretch during pregnancy, such as your breast, belly, thighs, and buttocks area. A few things that may help with stretch mark prevention, including gaining weight at a gradual pace and per weight gain guidelines for your pregnancy based on your pre-pregnancy BMI, and exercise per your doctor's recommendation. If you're considering trying creams or ointments, be sure to review them with your obstetrician before adding them into your daily routine. Changes in symptoms you may be experiencing. You may have been anticipating the second trimester for the energy gains and relief of morning sickness that are rumored to leave during this time. However, keep in mind, every pregnancy is different. There is a potential in continual fatigue and general tiredness. If you're continuing to experience these symptoms, continue to get adequate sleep, at least 7 to 9 hours each night, and take naps when you can or as needed. If you do experience a boost in energy, use it to make the most of physical activity, if it has been cleared by your doctor. Other symptoms you may still experience throughout this trimester that were previously discussed in the Trimester 1 module include bloating, flatulence, and constipation. Continue to follow the same recommendations for these symptoms that were discussed in the previous module. Some of those recommendations include drinking at least 100 ounces of fluid per day and getting adequate fiber, which is about 25 to 30 grams per day. For additional tips for managing these side effects, see the handout titled Common Side Effects of Pregnancy. You will also find more information regarding tips for exercise and safety considerations in the handout titled Exercise During Pregnancy. For a more personalized approach, be sure to reach out to your NutriVantage Mom's dietitian. Now let's move on to some new symptoms you may experience during this trimester. Remember, you're getting close to the halfway point. As discussed in the Trimester 1 module, the increase in hormones during pregnancy can lead to many of the symptoms you're experiencing. Because these hormones are continuing to help your baby grow and your blood volume continues to increase, your body will continue to experience side effects from those too. You may begin to notice, especially at night, that you're developing nasal issues. A stuffy nose or nasal congestion called pregnancy rhinitis may feel very similar to what you would expect to feel when you normally encounter a common cold. When pregnant, higher levels of estrogen can cause the lining of the nasal passages to swell and produce more mucus. An increase in blood circulation during pregnancy can also cause blood vessels in your nose to swell and cause congestion. Some strategies to help with this congestion include drinking plenty of fluids. Consider using a humidifier at night and clean regularly if you do choose to use one. Use a hot or cold pack on your shoulders or neck. Sleep with your head elevated on a few pillows. Avoid irritants that might cause more congestion, such as chemical fumes, cigarette smoke, paint, etc. Try taking a shower. The steam can temporarily relieve congestion. If you find that your congestion persists, be sure to speak with your physician or obstetrician first before trying any over-the-counter medications. Dental health is another aspect that may be affected during pregnancy. Your dental health can directly impact your baby and their oral health as well. Hormone changes during pregnancy may make your gums more irritated, inflamed, and sensitive, and may also lead to pregnancy gingivitis, morning sickness, and potential vomiting, which, as we stated, may be more common in the first trimester, may lead to more stomach acid ending up in the mouth, which may lead to weakened tooth enamel. You may be asking yourself, how does my dental health affect my baby? Excessive bacteria in your mouth can enter into your bloodstream, which can reach your baby. After baby's delivery, if you have excessive bacteria in your mouth, you may pass those high amounts of bacteria through something called vertical transmission. With all of these potential dental side effects of pregnancy to consider, be sure to brush and floss regularly. In addition, consider brushing and flossing after a high-sugar meal or after eating any particularly chewy foods that may stick to your teeth. You may also want to consider using a softer toothbrush if necessary to help with the sensitivity. Another helpful strategy for good oral health is consuming a healthy diet with limited added sugar intake. Finally, add a dental health visit onto your pregnancy to-do list if you have not done so already. Be sure to make them aware of your pregnancy when you make the appointment or during your visit. While we're on the topic of bacteria, you may also be more susceptible to urinary tract infections during pregnancy. Hormones that cause the muscle relaxation while pregnant can make it easier for bacteria to enter your urinary tract. Symptoms of urinary tract infections to be aware of include pain or burning while urinating, frequent urge to urinate, which should be differentiated from frequent urination, sharp pain to your lower abdominal area, and foul-smelling urine. If you're experiencing any of these symptoms, be sure to reach out to your physician. A UTI can also be diagnosed based on a urine sample provided at your doctor's office. You can implement some simple strategies to help prevent UTIs, such as drinking plenty of water to help flush out bacteria, wash and wipe your vaginal area well and completely, and take time to empty your bladder fully when using the bathroom. A good tip for that last strategy is to lean slightly forward when urinating to put pressure on your bladder in order to help empty it completely. Finally, let's talk about that pregnancy glow. Your pregnancy glow and other skin changes are due to your changing belly, hormones, and blood flow. Because your blood volume increases by approximately 50% during pregnancy, this increase, paired with an increase in oil gland production, can lead to that glowing shine look. However, on the opposite spectrum, the hormones that we've been discussing so far can also cause your glands to secrete more oil, which can contribute to breakouts or make existing acne worse. As you're spending more time looking at your growing belly, you may also begin to notice a darkening line running from your belly button to your pubic area. This line is called linea nigra. Throughout your second trimester, you may notice the line becoming darker. However, it will likely fade after delivery. As that line becomes darker, you may also notice moles and freckles becoming darker, as well as patching discolorations around your face and belly. This skin hyperpigmentation is again related to your hormones during pregnancy. Skin hyperpigmentation can also be intensified by sun exposure, so be sure to wear a sunscreen of at least SPF 30 when outside. Similar to linea nigra, these hyperpigmentations generally fade after delivery. Another type of hyperpigmentation you may experience is called melasma, which is referred to as the mask of pregnancy. Experienced by nearly 50% of pregnant women, melasma is the blotchy, bluish-gray skin discoloration that appears most often on the forehead and chin. Since melasma can also be intensified by sun exposure, it's another good reason to wear an SPF of at least 30 when outdoors. So your skin may be breaking out, you may have blue-gray blotches on your face, and now finally, you may start to experience leg cramps. Remember, you're almost halfway there. Leg cramps may become more common towards the end of the second trimester going into the third. These leg cramps may be caused by the weight gain associated with a healthy, progressing pregnancy and/or changes in your circulation. To help alleviate these cramps, try to alternate periods of activity with periods of rest. Put your feet up often to help decrease the amount of weight and load on your legs. When you're seated, flex your feet every now and then. Additionally, stretching can help, as well as a balanced diet with adequate fluid intake to ensure that you're getting proper nutrients such as magnesium, which can help with muscle cramps. Next, we'll cover how your nutrition and fluid needs change during this trimester. An increase in appetite is common in the second trimester due to a few factors that we've already reviewed. Your baby is growing, morning sickness may have improved, and you may be experiencing cravings. Calorie needs at this point increase by about 300 calories per day. Here are a few examples of what 300 calories looks like. These calories can be spread throughout the entire day or at different meals and snacks. For example, 1 hard-boiled egg plus 8 ounces of almond milk with 1 regular-sized banana. Another option would be 1 small 0.65 ounce bag of Skinny Pop popcorn along with 1 Baby Bell cheese and 1 pack of pitted prunes. Another option would be half a cup of non-fat plain yogurt along with a handful of almonds, approximately 23 almonds, and 1 cup of blueberries. And lastly, another example would be 1 small slice of whole wheat bread along with 2 tablespoons of peanut butter. The nutritional quality and balance of these extra calories is important to support your baby's growth and development. Smaller, more frequent meals and snacks may be helpful in order to obtain enough calories as your appetite changes and you may become fuller more quickly. Aim to have small meals or snacks every 2 to 3 hours or sooner than that if you're experiencing signs of hunger. Being aware of your body's hunger and fullness cues is helpful to prevent you from becoming too hungry or getting uncomfortably full. For more tips on mindfulness and hunger and fullness, please see the Mindfulness Strategies handout in this module. For snacks, think of pairing a healthy carb for energy along with a good protein source for satiety and blood sugar control. Eating in this balanced way may also help with cravings. Some examples of these pairings would be 1 small tortilla with an ounce of turkey breast, 1 cup of raw vegetables along with 1/3 of a cup of hummus, or an apple with 1 tablespoon of almond butter. Another way to achieve this balance is called the My Plate method. Please see the My Plate handout for more information. It may be helpful to store some shelf-stable snacks with you in your purse or at your desk at work so you always have access to food if you need it. Sometimes pregnancy hunger can be a little bit unpredictable. For other ideas that may be helpful for meal planning, see the handouts titled Portion Sizes, My Plate, and Assemble and Eat Meals. If you want more of a personalized approach, be sure to reach out to your NutriVantage Mom's dietitian. Fluid needs increase during pregnancy, and this is for many reasons. To name a few, production of amniotic fluid to help aid in the digestion and absorption of the important nutrients your baby needs, helps to regulate your body temperature, may help to prevent constipation and muscle cramps. Water is also necessary for good circulation and many other things that affect yours and your baby's health while you are expecting. The Institute of Medicine recommends at least 100 ounces of fluids per day for pregnant women. You can monitor the color of your urine as an indication of your hydration status as well. If you're well hydrated, your urine should be light yellow to clear in color. Try to have access to water and fluids with you all day long. Start the day with 8 to 16 ounces of water. Drink before and or with meals and snacks. Carry a reusable water bottle and set an alarm on your phone for every 30 minutes to an hour if it's difficult to remember to drink. How much weight should you expect to gain? Weight gain per week is based off your pre-pregnancy weight. During the second trimester, your weight gain will become more rapid as compared to the first trimester to support baby's growth. For a woman with an average pre-pregnancy weight, 1 to 2 pounds weight gain per week is the recommendation. As mentioned in the Trimester 1 module, weight gain guidelines are based on pre-pregnancy BMI. For more information about weight distribution during pregnancy and recommended guidelines, please see the handout titled Healthy Weight Gain During Pregnancy, which can also be found in the first trimester module. Now let's move on to the nutrients of focus for the second trimester. 3 nutrients of concern are iron, vitamin B6, and vitamin B12. Let's begin with iron first. Iron is a vital nutrient as it helps our body transport oxygen to our organs. For that reason, this nutrient is even more important during pregnancy. During pregnancy, you need double the amount of iron compared to non-pregnant women in order to make more blood to supply oxygen to your baby. The other roles iron plays include energy production and growth and development, which will continue through infancy. Iron deficiency is the most common pathological cause of anemia in pregnancy. Globally, over 40% of pregnant women are anemic from all causes, and in the United States, prevalence of iron deficiency was 16.3%, with a higher prevalence in non-Hispanic, Black, Mexican Americans, and low-income pregnant women. Iron deficiency in pregnant women is defined as a serum ferritin level of less than 12 with a hemoglobin of less than 11 and a hematocrit of less than 33%, according to the Center for Disease Control and Prevention, as well as the World Health Organization. Risk factors for iron deficiency can include short intervals between pregnancies, gastrointestinal issues that affect absorption, or a diet low in iron-rich foods. Being deficient in iron may lead to an increase in premature birth, having low birth weight, and postpartum depression. However, according to a report done by the U.S. Preventative Task Force, more research needs to be done to assess conclusive evidence for those risks. Symptoms of iron deficiency during pregnancy are fatigue and weakness, which can be difficult to identify provided you may still feel some fatigue during your second trimester. However, other symptoms include pale or yellowish skin, shortness of breath, cold hands and feet, and dizziness or lightheadedness. Again, since these symptoms are close to those of pregnancy, ask your doctor or obstetrician if you are concerned. So how much iron is needed? During pregnancy, you need 27 milligrams of iron daily. Most prenatal vitamins should include iron. However, there are food sources of iron you should incorporate daily to ensure adequate intake. Animal products such as lean meats are the most bioavailable source of iron, which means that our bodies are able to easily absorb and utilize it. For those who are vegetarians or do not consume meat on a regular basis, you are able to get iron from non-animal sources. Many of the cereals and breads we eat can be fortified with iron. However, look at the label to be sure. Other food sources of iron include dark leafy greens, mushrooms, legumes, and beans. Because vitamin C helps our bodies to absorb the iron, it is recommended that when consuming a plant-based source of iron, to incorporate a source of vitamin C along with it. For example, if you're having oatmeal for breakfast, consider having a small glass of orange juice with it, or even an orange. Now let's talk about some B vitamins, starting with vitamin B6. Vitamin B6 is critical for healthy function of the brain and nervous system and plays a crucial role in the development of your baby. Our bodies need vitamin B6 in order to produce serotonin and norepinephrine, which are both key neurotransmitters. In addition to the development of your baby, vitamin B6 can also help to maintain a healthy blood sugar level and prevent issues with your newborn such as eczema and low birth weight. The recommended daily allowance for pregnant women is 1.9 milligrams. However, most adult women under age 50 should be taking between 2.5 to 25 milligrams per day, which can be easy to achieve through a healthy diet. During your first trimester, your obstetrician may have recommended taking additional supplemental vitamin B6 to help with nausea or morning sickness. If you're still experiencing nausea and morning sickness and are taking additional B6 to help alleviate symptoms, speak to your obstetrician about this option, as excessive intake, defined as over 100 milligrams per day, can lead to nerve damage, numbness, and other conditions. On the other hand, vitamin B6 deficiency can occur. Deficiency can occur through inadequate intake, excessive consumption of alcohol, processed foods, and high sugar foods. Common symptoms of B6 deficiency include anemia, depression, mood swings, fatigue, and inflammation of the skin and joints. However, it should be noted that severe deficiencies are uncommon. If you're concerned about an excessive intake or deficiency of vitamin B6, speak to your physician and NutriVantage Mom's dietitian for a comprehensive diet analysis. Sources of vitamin B6 include whole grains, seeds, nuts, some fruits, lean meats, beans, and legumes. So if you're eating a balanced diet, you should be getting the vitamin B6 needed for both you and your baby. Finally, let's talk about vitamin B12. Vitamin B12, also called cobalamin, is a critical nutrient for maintaining the health of your nervous system. Combined with folic acid, vitamin B12 can help prevent spina bifida and other spinal and nervous system birth defects in your baby. More specifically, when looking at your baby's development, vitamin B12 is essential for neural tube formation and spine development. Because of the nervous system role that B12 plays, there have been several studies to assess the cognitive development between infants and children from mothers who are deficient in vitamin B12 compared to those who had normal levels. Before we review some of the studies, you should be familiar with homocysteine. Homocysteine is a common amino acid in your blood that is associated with early development of disease, such as heart disease. Low levels of vitamin B12, B6, and folate are associated with increased levels of homocysteine. So, one potential way to identify whether you are deficient in B12 is to assess homocysteine levels. Now let's move on to a few studies. One double-blinded placebo-controlled trial provided oral B12 during pregnancy and early lactation to women in South India where there is a high prevalence of vitamin B12 deficiency. The focus of the study was to report the effect of maternal B12 supplementation on cognitive function in infants at 9 months of age. Although there was no effect on maternal B12 supplementation on early neurocognitive outcomes, higher homocysteine levels in the moms were associated with poorer performance on language expression and fine motor skills. Another study measured maternal B12 concentrations in 443 mother-infant pairs at 26 to 28 weeks gestation, and again when the infant was 24 months old. Results from the study indicated that mothers with B12 deficiency had lower cognitive scores in infants compared with infants of mothers with sufficient levels. However, it should be noted that the association between maternal B12 and cognitive function in infants warrants further research. Now, how much B12 should you be getting each day? During pregnancy, you should be getting 2.6 milligrams daily. Vitamin B12 is exclusively found in animal sources such as lean meat, fish, poultry, eggs, and dairy. So if you are vegan or vegetarian, it is important to have a conversation with your physician on supplementation. Next, we'll review the labs and testing done during the second trimester. You may be counting down the days or weeks until your second trimester anatomy scan, where you can decide to have the gender revealed to you. If you're unfamiliar with the second trimester ultrasound, it typically takes place between 18 to 22 weeks gestation and is a critical tool for detecting fetal abnormalities. During your ultrasound, technicians will be scanning, measuring, and taking pictures of the following areas on your baby: the head, face, heart and chest, abdomen, and musculoskeletal system. In each of these areas, the technician is looking for specific features. For instance, in the heart and chest area, the technician will want to scan for the heart rate and rhythm, cardiac situs, the four-chamber view, outflow trach views, aortic and ductal arches, and the diaphragm and lungs. This anatomy scan can take time and be overwhelming, so don't be afraid to ask questions. Some questions to consider asking include: does my baby's heart have four chambers? Are you finding my baby's heart function to be normal? Are the stomach and heart both on the left side? Or you might find that the technician may explain as he or she goes along. And finally, the gender reveal. Most technicians will ask you prior to the scan if you would like to know. If you have a special envelope you want the gender or images to go in from the scan, be sure to bring those along to the appointment. And finally, the excitement of quickening. The first movements of the baby are known as quickening. You may begin to feel the baby kick anywhere between 16 to 25 weeks gestation. These kicks may feel like bubbles, tiny muscle twitches, flutters, a light tickle, or a gentle thud or tap. As your baby begins to have less room to move, these movements will become more and more apparent and may be the first signs of the personality that she or he might have.